What's wrong with U.S. healthcare? Oh, honey, where do I start? To share with you some of the highlights of Mirror Mirror 24, a portrait of the failing U.S. health. In this report, the healthcare systems of 10 countries are compared, and that includes the United States, the United Kingdom, Australia, Canada, France, Germany, the Netherlands, Sweden, and Switzerland. And New Zealand, if I didn't say New Zealand. And they examine 5 key domains: access to care, care processes, administrative efficiency, equity, and health outcomes. Now, no country was perfect. Some countries did better in certain aspects, some did better in other aspects, so no one was number 1 in every category, no one was number 10 in every category, but we were damn close. So this is how everyone ranked. Overall rating, we came in number 10. Access to care, we are also number 10. Administrative efficiency, care process, and I'll explain each of these things in a second. Care process, we are number 2. Woohoo! Administrative efficiency, number 9. Equity, number 9. Health outcomes, number 10. And when comparing our performance overall, not only are we number 10, but we are so fucking number 10. And that is despite the fact that as a percentage of our gross domestic product, we spend the most money. That's us way up there. We spend more money as a country than any of the other countries do. As far as access to care, we do poorly because the high out-of-pocket cost that patients have, and also because there is a shortage of primary care doctors. In Germany, co-payments are capped at 2% of the patient's income, or 1% if they have a chronic medical illness. Whereas in the United States, 41% of people spent more than $1,000 in the past year out of pocket. We did pretty good with care process, and that included things like prevention, safety, coordination, patient engagement, and sensitivity to patient preferences. And that was good primarily because of efforts to increase cancer screening, as well as processes that have been put in place to improve treatment of pneumonia, congestive heart failure, and heart attacks. We did poorly and ranked number 9 administrative efficiency because of all the paperwork and regulatory stuff and insurance and the difference between copay and coinsurance and all that shit. Next, equity, number 10. This is partly because of the disparity between access to care between people who are of lower income and people who are above average income. But they also took into consideration whether patients reported whether they had been treated unfairly or not taken seriously when receiving health care, and they also asked physicians whether they thought that the health system treated patients unfairly because of their racial or ethnic background. Next, health outcomes. You would think with us spending all the money that we spend that we would have better health outcomes, but no, we are number 10. The outcomes that were measured were life expectancy at birth, excess deaths due to the pandemic, because this data was gathered during that 3-year period of the pandemic, deaths with preventable and treatable causes, and our life expectancy is 4 years below the 10-country average, and we have the highest rates of preventable and treatable deaths for all ages, as well as excess deaths related to the pandemic for people under the age of 75, and we have the overdose and the gun violence deaths. So what can we do to make things better? I know that everyone is talking about the presidential election, and I am not going to say anything about either candidate. That is not what this platform is for me. But it starts at the grassroots. It starts with your local representatives. When you go and vote next month, make a difference. Look at what the platforms are. Look at what bills and laws your representatives are supporting, and choose wisely. And whoever gets elected or whatever position, you need to reach out to them. There's 330 million of us, give or take, and they want our votes. So the only way for them to know what you want is if you tell them what you want, and we need better health care.